Okay, so now we're going to talk about acquired cardiac diseases. The first thing I want to talk about is mitral valve prolapse. That's when the mitral valve leaflets prolapse back into the left atrium and allow some backflow. So when they're supposed to close to keep blood in the ventricle, they allow some blood to swish back into the left atrium. Most of the time, this is asymptomatic and benign. So what are we going to see if they do have it? They might have a mid-systolic click, okay, in the middle of that systole, you may have a click, or a late systolic murmur. They may have atypical chest pain that doesn't respond to nitrates, a sharp pain that doesn't respond to nitrates. They may feel anxiety, they may have palpitations, they may get short of breath on exertion, and they may pass out. Okay, management of this, if they're symptomatic, beta blockers are used to manage it. If it's severe, assess thyroid function. Prophylactic antibiotics are no longer recommended for this patient. So a patient who has mitral valve prolapse who's asymptomatic may actually get a little bit worse during pregnancy. Mitral stenosis, also those beta blockers, there is some risk to giving them in pregnancy. So they're usually only going to be given if they're really needed to control heart rate for that patient. Mitral stenosis is the next one, and that's when that mitral valve is narrow and stiff, so it obstructs blood flow from the left atrium to the left ventricle. Okay, mitral valve prolapse, it's too soft, it lets blood go back. Mitral valve stenosis, it's too stiff and it doesn't let blood go forward. So this is almost always the result of rheumatic fever. This is one of the reasons we treat strep throat. Okay. It may be asymptomatic. Sometimes someone who has mitral valve stenosis will first start noticing they have symptoms in pregnancy. Some of the complications, they can have pulmonary edema, right-side heart failure. They can develop infective endocarditis because when blood can't go forward, it tends to pool and bacteria can collect. Bacteria can collect on that stiff valve. So they're also at risk for pulmonary embolism because of that pooled blood potentially clotting. And sometimes they'll have some cough up some blood because of the heart failure. The management for this patient needs daily antibiotic prophylaxis if they're possibly exposed to strep. If they're NCHF, they get diuretics. If they're tachycardic, they need beta blockers or calcium channel blockers. Again, remember there's some risk of that. If they have new onset atrial fib, they'll try to cardiovert that and get them back into a normal rhythm. This patient probably needs increased rest and reduced activity because when we increase their activity, we increase their oxygen demand, and that may actually make their CHF worse. They need restricted sodium because they have a difficult time getting fluid off. Monitor their weight. If they have a sudden weight gain, they may be moving into worsening heart failure. We monitor for signs and symptoms. Sometimes they may have an echo to determine if they're getting worse. We want them to not experience pain in labor, so an epidural is preferred in labor because if they're hurting, they get tachycardic, and that's going to make their heart failure worse. Vaginal delivery is preferred, but we don't want them laying on that vena cava. We want them in a supine position, in a lateral position. We don't want them in lithotomy. We don't want them supine. Probably heavy epidural assisted birth to decrease that second stage so we don't stress the heart. A cesarean should only be done if it's indicated obstetrically, if it's going to be if there's an obstetric reason for that. After birth, they need aggressive diuresis to get because they'll go into severe heart failure. If they have really severe disease, they may actually do some surgical correction on that valve during pregnancy. The last one we're going to talk about with acquired cardiac disease is aortic stenosis. This is when the aortic valve is narrow, so blood trying to get from the left ventricle into the aorta is obstructed. It's really rare in pregnancy. It's going to have a lot of the same symptoms as mitral stenosis, and it's managed similarly to mitral stenosis. We're going to come back in the next video and talk about ischemic heart disease in pregnancy.